So when we look at stem cell therapy, my biggest question that I have for most patients is, what happened to yours? Because if we can understand what happened to yours, I can understand the forces that are working against you that are going to ultimately try to snuff out that $1,500 shot you just put in your knee. Remember back when you were in school and you're sitting in school thinking about, what kind of doctor do I want to be? What kind of provider do I want to be? Somebody asks you a question, what are you going to do? Man, I'm going to destroy chronic disease. That's what I'm going to do. And then you get out of school and you get into the healthcare situation, and man, it's a little different than what it was as far as your vision, right? And modern healthcare has a way of just squishing people into a box so that you then become part of a system. The problem comes into play when we have patients that have lived a wild life, right? Everybody thinks it's the old football injury, that's why their knee hurts. It's not the old football injury, it's the old donut injury, right? It's food accumulation for decades and decades. That's the injury. And this is what I call a root and fruit. This is a root and fruit perspective. Now here at the top of the tree, we have a bunch of chronic conditions, and you can see all those different chronic conditions. These are the things that people are getting medicated for every day in every clinic in America. What we want to understand is that the healthcare system around this disease tree, healthcare system around it exists to suppress, to decrease, to try to bring down the symptomatic experience. And I think it's noble to do that, right? But at some point, you got to ask the question, why is this happening? As these mitochondria lose their ability to protect themselves, they become dilapidated, they become wrinkly. Look at that mitochondria, it's wrinkly. What's going on their skin is also going on in the organelles and the cells of the tissue. But when a cell doesn't want to die, what it's going to do is it's going to become insulin resistant. That insulin resistance is a protective mechanism, right? So I spend most of my days battling against this protective mechanism, not by trying to overwhelm it, but by trying to get rid of the reason that it's there. You guys remember the Peanuts cartoons? And you have Pigpen, you remember that character? Right, he got that cloud following him around all the time. And that energetic cloud that we're living in is very small when we're young, right? Hopefully, okay? Very small. But as we go throughout life and we start getting into our 30s and 40s and 50s, the energetic cloud, unless you control it, continues to grow. What's taking place is these environmental chemicals that you're not going to get away from are causing a gut injury, forcing your patients to not be able to regulate the inflammatory response any further. The problem is that obesogens force stem cells to differentiate into adipose tissue. They force them to differentiate into adipose tissue. This is problematic, okay? Has everybody had that one patient that can eat 200 calories and they don't lose any weight? Right, where they try the weight loss drug and they gain 10 pounds and you're like, this is something. One of my favorite things is interrupting this cycle. Because if we can interrupt this cycle, you can change somebody's life. And if you can change their life, they're gonna go tell somebody else, and it's gonna be a more smiley world. Intervene, make this patient's life better. Smile, give them an opportunity to have a quality of life worth living. I love it. I also like pairing nutritional intervention in a plug-and-play setting with the Regen services. Ultimately, what I wanna be able to do for these patients is to interrupt this environmental-driven chronic inflammatory mechanism that is absolutely destroying their physiology. When a patient can't get well, you want to look for the driver, okay? And at some point, you're gonna find it.